स्विच आपको करना है, एक्टिव भी करना है, untitled कर दे इसमें सर, कर दिया ना आपने, स्टार्ट हो गया।
स्टूडेंट्स को आने दीजिए।
यहाँ पे साफ होते हैं वो टेबल सैटरडे को वो आए थे क्लास के लिए, मेरे नाम से वो स्टूडेंट प्रेजेंटेशन, मेरा प्रेजेंटेशन कोई कुछ नहीं है, लिंक भेजा जो लिंक मैंने भेजा है ना उससे ही लिंक विल कनेक्ट विद फ्राइडे एट एनी डे ऑन दिस। तो अगर आपको ये शेड्यूल मिलती है तो सेम लिंक काम करेगा, अगर दूसरी शेड्यूल है तो फिर दूसरी। अच्छा आप once it is sent presentation
आवाज आ रहा है, रिकॉर्ड भी हो रहा है, तो अभी जो बोल रहे हैं सारा रिकॉर्ड।
Good afternoon, students. So this is Levis, and today we are going to have a class on ethical issues in nursing. I hope you have got a link and you have logged on. There is a chat box, so if you have any questions you can type on the chat box. I won't be able to see it in between the presentation, but we will take the questions at the end of the presentation. So let's start with the presentation. So nurses, as we know, we work in a clinical setting and we can contribute favorably to ethically challenging clinical situations. And we do face ethical situations at workplace, but practically we don't actively participate in ethical decision making related to clinical care. Usually we pass on the honors to the physician. Nurses can contribute to ethical issues by interdisciplinary collaboration and ethical assertiveness on the part of nurses. And in order for the nurses to participate in ethical issues decision making, the nurse leadership can play an active role in encouraging nurses to actively practice ethical conduct. So what is ethics? We all know that ethics are practices or beliefs of a certain group. So in this case, as nurses, we have the nursing ethics. It is also defined as the expected standards of moral behavior of a particular group. Ethics in nursing is a set of moral codes of professional behaviors towards holistic care. We have the nursing organizations and the statutory body of nurses, the INC, which sets the ethical code of conduct and professional behavior for nurses in India. Let's look at a code of ethics. A code of ethics is a formal statement of a group's ideals and values. So what is the purpose of code of ethics in nursing? Standards for the behaviors of nurse and provides general guidelines for nursing action in ethical dilemmas. So it is actually not legally binding, but you have the code of ethics to guide you to take the correct behavior or the appropriate behavior when the situation arises. The code also helps to distinguish between right and wrong at a given time, especially when alternatives appear just as satisfactory. What it means is, if you have two options, then the code of ethics will guide you as to which option you should take. The code enables a correct decision and uniform decision within the groups, and it helps to protect right of individual families and community, and also the right of the nurse. Ethical principles. There are four fundamental ethical principles. The first is the respect for autonomy, which means that a patient has a right to refuse or choose their treatment. This is an example of autonomy. The second ethical principle is the beneficence. What it means is a nurse should act in the best interest of the patient. So the word beneficence means to do good. So the nurse always tries to do good to the patient, or try to act in the best interest of the patient. Then there is the principle of non-maleficence, which means first do no harm or avoid harming the patient. And then there is justice. By justice, we mean that we are making sure that those in similar circumstances are treated the same, whether concerning the distribution of scarce health resources or who receives which treatment. So these are the four fundamental ethical principles: respect for autonomy, beneficence, non-maleficence, and justice. There are other ethical principles also. Some of them may be overlapping, but I'll just list them out. So when we talk about respect for a person, it involves level of understanding of another person, or empathy, which means that you try to put yourself in the shoe of somebody who is suffering, or try to feel their suffering. Autonomy, as we have already defined, it defines the person's independence and self-determining actions. When it comes to the principle of beneficence, we are actually seeking the benefits or promotion of good for that person, and the duty to do balance between beneficence and harm, because however much we try, we cannot always do good. So we have to balance between the more beneficial and the least beneficial for the patient. Principle of justice, which is a basic principle that each person has equal right to the liberty available to everyone. Principle of veracity, which is the obligation to tell the truth. Then principle of fidelity, the duty to do what one has promised. The ICN Code of Ethics. So the International Council of Nurses, they have given Code of Ethics for nurses. So the ICN is an international body which is a conglomerate of the individual national nursing associations. So as in India, the INC is a member of the ICN. Even the TNAI is a member of the ICN. So the nurses have four fundamental responsibilities according to ICN. That is to promote health, to prevent illness, to restore health, and to alleviate suffering. In the ICN Standards of Ethical Conduct, it defines how nurses should conduct towards the people. So there are a list of ethical standards which the ICN has given. I have not included it in my presentation, the particular specific points, but it talks about how the nurse should be conducting towards the people. The people here in a sense is the patient. So it's about the respect, the advocacy the nurse should play, and all the other ethical principles. Then it talks about how the nurse should conduct herself or himself towards the practice of nursing. So how the nurse should be truthful, and the scope of practice, and the things the nurse should do, should not do. So that kind of things is there in the practice of nursing. And then the third one outlines how the nurse should conduct towards the profession. So nursing, as we know, is a standalone profession in itself, and how the conduct should be done, it is outlined in this aspect. Then the nurses conduct towards their co-workers. So here it defines what should be the code of conduct of the nurse towards the co-workers, it may be the nurses or the doctors. So that aspect is given in this section. We will see about a code of ethics for nurses in India. In India, the Indian Nursing Council, INC, has laid down code of ethics and professional conduct. The first one relates to the uniqueness of individual. The nurse respects the uniqueness of individual in provision of care. So here, what is the expected ethical conduct of the nurse? The nurse provides care for individual without consideration of caste, creed, religion, culture, ethnicity, gender, socioeconomic and political status, personal attributes, or any other grounds. Individualize the care considering the beliefs, values, and culture. The nurse appreciates the place of individuals in the family and community and facilitates participation of significant others in the care. The nurse develops and promotes trustful relationship with individuals. Second, the nurse respects the rights of individuals as partners in care and help in making informed choices. The nurse appreciates individuals' rights to make decisions about their care and therefore gives adequate and accurate information for enabling them to make informed choices. They respect the decisions made by individuals regarding their care. So here again comes the principle of autonomy, and in sharing the right information, the nurse is also, this is also touching upon the principle of veracity, or to say the truth. 3. The nurse respects individuals' right to privacy, maintains confidentiality, and shares information judiciously. Respects the individual's right to privacy of their personal information. The nurse maintains confidentiality of privileged information except in life-threatening situations and uses discretion in sharing information. So it is the nurse's duty to maintain the privacy of the patient, and the nurse should maintain that. Just there's one exception here, that if it is a life-threatening situation, then the nurse should use her or his own discretion in sharing the information. Limits the access of computerized information to authorized persons only. Nurse maintains competence in order to render quality nursing care. So what are the points in this? Nursing care must be provided only by a registered nurse. Nurse strives to maintain quality nursing care and upholds the standard of care. Nurse values continuing education, initiates and utilizes all opportunities for self-development. Nurse values research, adhering to ethical principles. Fifth, the nurse is obliged to practice within framework of ethical professional legal boundaries. The nurse adheres to Code of Ethics and Code of Professional Conduct for Nurses in India, developed by Indian Nursing Council. familiarizes with relevant laws and practices in accordance with the law of the state. Sixth, nurse is obliged to work harmoniously with members of the health team, appreciates the team effort in rendering care. The nurse cooperates, coordinates, and collaborates with members of the health team to meet the needs of the people. Nurse reciprocates the trust invested in nursing profession by society. The nurse demonstrates personal etiquettes in all dealings, demonstrates professional attributes in all dealings. So these are the code of ethics which are laid down by the Indian Nursing Council, and as you can see, it ranges from how the nurse should be respecting the rights of the patient, and how the nurse should behave with their co-workers, what is the role of confidentiality for a nurse, the professionalism the nurse should show to its profession. So this all this comes under the preview of the code of ethics. Now let's look at the code of professional conduct for nurses. The first one is the professional responsibility and accountability. Professional responsibility and accountability. The nurse appreciates sense of self-worth and nurtures it. Maintains standards of personal conduct, reflecting credit upon the profession. So what it means is the way you conduct, even personally also, should be should be a reflection of who you are as a nurse. So you cannot be some other person in the clinical or in your workplace and some other person at home. So you'll have to maintain the dignity of the profession at all times. Carries out responsibilities within the framework of the professional boundaries. Is accountable for maintaining practice standards set by Indian Nursing Council. So here comes the role of accountability, that the nurse is accountable for his or her own practice. Is accountable for own decisions and actions. So any decision and actions that the nurse takes, he or she is accountable and will be accountable by law also. The nurse is compassionate, is responsible for continuous improvement of current practices. So the nurse is responsible for his or her own practice, provides adequate information to individuals that allow them informed choices. So dear students, it is the responsibility of the nurse to provide information to the patient. So we cannot always pass on the onus saying that that so and so doctor will provide information for this. So if it depends on the nature of information that you are giving. So if a patient asks you something, then it is your responsibility to provide the right kind of information, and the healthcare workers, they should work as a team in order to keep the patient informed, and so that the patient can take the right decision. Practice healthful behaviors. So as nurses, it is in our code of professional conduct that whatever we practice personally, professionally, it is healthy. We are people whom others look upon, and we need to be maintaining helpful behaviors. Second point is on nursing practice. The nurse provides care in accordance with set standards of practice. Respect individual and families in the context of traditional and cultural practices, promoting healthy practices and discouraging harmful ones. So many times we see in the clinical area also that we tend to judge other people on what they do as a cultural or traditional practice, and we always start with negativity in our sentences and the way we conduct ourselves. So instead of that, the code of conduct is telling us to respect individuals and families. Point out something which is positive first, and then try to understand the psychology of the family, why they are doing what they do, and try to suggest. Instead of ordering, we can suggest them to adopt some of the healthy practices and give them examples on how adopting healthy practice can make a difference in their health and discourage harmful practices. The nurse should treat all individuals and families with human dignity in providing physical, psychological, emotional, social, and spiritual aspects of care. Promotes participation of individuals and significant others in the care. So it is again in the professional conduct of the nurses that we allow the family to participate in the care of the patient or the individual. So it is we have seen in so many research also that if the family is involved, the concept of family centered care should come in, even in terms of adults also. In pediatrics and in newborn, it is very much followed, even in India also, but it may be little lacking in adults. So if it is the case, then we as nurses should allow more of family centered care, even in case of adults also, because once the patient goes back to the home, then the family is the one who is going to take care of the patient. So if we are not allowing or participation of the family from day one on what should be the medication of the patient, what should be the diet, what should be the practices, when to come for follow-up, and all those things. If we are not teaching the family from day one itself, that leads to so many complications later on, and you can end up having unanticipated admissions and problems in healthcare. So there needs to be a lot of research done on this aspect, even in India also, and we should promote participation of individuals and significant others in the hospital. We should ensure safe practice. So it is easier said than done, but a nurse should try at her own level to make sure that whatever she is practicing is safe, and she needs to take the others with her, the doctors, her co-workers with her, try to advocate things that leads to safe practice, and make sure that the healthcare which they are providing is safe for the patient. Consult, coordinates, collaborates, and follows up appropriately when individuals' care needs exceed the nurse's competence. Yes, so very often in our practice we see that the patient may need or require other members for care, and it is the duty of the nurse to escalate the matter, and if the patient needs a higher level of care, or somebody who is more apt to take care of the patient, then the nurse needs to coordinate the care and collaborate with the others so that the patient receives the right kind of care. Communication and interpersonal relationship. This is the third point in the professional code of conduct by the INC. The nurse establish and maintains effective interpersonal relationship with individuals, families, and community. Very important again that we maintain IPR with the families and communities. So very simple things makes a big difference. Whenever you go to the clinicals, you should make it a point to introduce yourself with your name and what are you. So you can say, I am so and so, I'm a nursing student and I'm here for this much time. So it is your duty to know that the patient should know that why you are here and how much time that you will be there, so that you can establish a trusting relationship with the patient. And when you become staff also, it is very important that you go introduce to yourself to your patient and tell him or her that you are there for that shift and you can be approached for any questions. So it will be a good idea to try this out actually, like whether some nurses may have that impression that that will increase the workload, but let's see whether it increases or not. Even a research study can be done on this, I suppose. Uphold the dignity of team members and maintains effective interpersonal relationship with them. So again, important that we as nurses and as health teams, we respect each other and we conduct with each other in dignity, and we try to maintain a cordial relationship, interpersonal relationship with each other, or a professional relationship with each other. Appreciates and nurtures professional role of team members. So it is the duty of the nurse again to show respect to others around them, the dietitian, the physiotherapists, the doctors, the technicians, the class 4 workers. So everyone has a role in the health team, and the nurse should take the lead in make sure that the team members are respected. Cooperates with other health professionals to meet the needs of the individuals, families and communities. So it is the duty of the nurse that she cooperates with her co-workers so that the health of the patient is restored. The fourth point is valuing human being. The nurse takes appropriate action to protect individuals from harmful, unethical practice. So after this, we will be discussing more on ethics. I think on Saturday, Janni is going to have a presentation on more of ethics again. And it is a duty of the nurse that she takes appropriate action if he or she feels that there is some unethical practice going on which is going to harm the patient. Encourages and supports individuals in their right to speak for themselves on issues affecting their health and welfare. So it is important that the nurse maintains an atmosphere of freedom in the ward, that the patients are encouraged to speak up. And this has been shown by many research studies also, that if you are empowering the health team and the patients to speak up, then you have more chance that there will not be any error in the things that we do. So it reduces the medical errors. So it's important that a nurse, because the nurse is there 24/7 in the wards with the patient, if the nurse is encouraging that kind of environment, then the patients will benefit and the patients will be safe in those kind of atmosphere. Respects and supports choices made by individuals. So it's important that the patients know what are their health choices, and the nurse also takes a lead in respecting and supporting the choices which are made by individuals. But it should not be a kind of decision made in the dark. We have already seen in the code of conduct that the nurse is supposed to provide information to the patient. So once the patient has the right information, then and then making a decision regarding his or her care, then it's a responsibility of the team members to accept and respect the choice of the patient. Fifth is on management. The nurse ensures appropriate allocation and utilization of available resources. Very important that the nurse does that. Participates in supervision and education of students and other formal care providers. So it is again the duty of the nurse to supervise and to utilize himself or herself for educating the students who are there in the clinical area. Use judgment in relation to individual competence while accepting and delegating responsibility. Again, it's important that the nurse judge accordingly when he or she is accepting any responsibility. So there are two things here: you are accepting responsibility and you are delegating responsibility. So while accepting also, it is his or her duty to see that whatever they have accepted they must be competent enough to do it. Otherwise they should not accept any responsibility where they are not confident or not competent to do that, because it is going to result in patient harm, and that is against the ethical responsibility of the nurse. And while delegating responsibility also, it is the duty of the nurse to make sure that the person she is delegating to is capable of doing that responsibility, because ultimately the nurse is accountable for that task. Communicates effectively following appropriate channels of communication. So it is the duty of the nurse to communicate effectively and to follow the appropriate channels as per the organizational protocol in order to communicate whatever needs to be communicated. The nurse participates in evaluation of nursing services, participates in policy decisions following the principle of equity and accessibility of services, participates in performance appraisal, works with individuals to identify their needs and sensitizes policymakers and funding agencies for resources allocation. So we have just had one class on policy making, and we have talked in detail about how nursing can play a role in policy making decisions and influence decision making. So it is just remember that this is also there in your code of professional conduct. The sixth is the professional advancement. Nurse ensures the protection of human rights while pursuing the advancement of knowledge, and so this is particularly in regard to research. Contributes to the development of nursing practice, again through research and through advocacy, and contributes to core professional knowledge by conducting and participating in research. All right, so with this we have seen about the code of professional conduct for nurses, which is given by the INC, and I'm sure you have now some idea regarding what is the ethical conduct and code of professional conduct. So these are not legally binding as per se, but then if there are some legal implications in the practice, then the ethics part will also play a role in the decision. Now let's look at some of the ethical situations in nursing. So Olsen describes, it's an article from where Olsen was the author. He describes 4 types of ethical situations faced by nurses. The first one is the wrongdoing. By wrongdoing, it means when a nurse perceives some action or policy to be hurting people unnecessarily or to be unfair. So if a nurse sees or perceives some action where he or she thinks that it is hurting some people, or it is not fair on that person, then what should the nurse do? So that is one ethical situation. So whenever there's a situation where you have to ask yourself, what am I supposed to do in this situation, then it may be that facing an you are facing an ethical situation, and you will have to make a decision regarding that. So more of that will be again dealt in the seminar which Channi will be doing. In this class I'll just describe these situations. Specific situations in nursing practice will be discussed during the seminar. The second type of ethical situation which nurses can face is a dilemma. So dilemma means when a nurse holds two or more values that cannot be acted on simultaneously in a given situation, which is termed as an ethical dilemma. So here you have two or more compelling values, like it is not exactly right or wrong, but then you'll have to decide which one should be taken, which decision should be taken. So that will put you in an ethical situation. The third one is acting on values. When more than one course of action exists and choices must be weighed with regard to a legitimate value in a clinical situation. So this is again in other words, not a question of right versus wrong, but which option is better. So this is again something like the second one, but it is not exactly a dilemma. It is more on values, like which one should be used. So it's both of them are good actually, but which one should be used so that the patient is benefited more. Then the fourth one is determination of values. When nurses explicitly examine what their professional values should be. So some situations can let you introspect yourself. Okay, in this kind of situation, how am I supposed to behave professionally? So if there are some situations like that, then that is again an ethical situation. In the TNAI website, I found some of the issues which they have given, which are affecting the ethical conduct of nurses. So I've just listed it down for you. Let's look at them. So the first one is the overstretching of healthcare facilities. So we all know that if there are too many patients and there is heavy workload in the healthcare scenario, then the ethical conduct of the nurses can be compromised in such situation. So that will present an ethical situation for a nurse. And if there is inadequate nursing organization structure to facilitate quality care, so the way the nursing is organized in the hospital, that itself can create an ethical situation where the nurses are competent, or they may be in good numbers to give good quality care, but because of the way it is organized, you are unable to give the best care that you want to, or the care is somehow compromised. So this can lead to an ethical situation. Defective recruitment rules to ensure appropriate utilization of nurses. So again, this presents an ethical dilemma because you are not utilizing the right personnel for the right job. So that is not right on the public, neither is it ethically right on the nurses. So it is two ways actually. The public whom the nurses are serving, they are also affected by this, as well as the nurses who have been employed will be affected. Deficit education facilities and opportunities for nurses on the job, updating their skills and for further advancement. So this is again morally wrong or ethically wrong that you don't have enough facilities to give continuing education to the nurses, and there is no on-job training for nurses to update their skills, and there is no scope for further advancement. So this is again a source of ethical issue for nurses. Unprotective work environment, so it can be an ethical issue. So right now we have the COVID-19 pandemic, and there has been reports of mistreatment, over use of PPEs, and that kind of thing, even from the students also. So that again raises an ethical concern. Uncontrolled privatization and commercialization of health services, again there is an ethical issue related to this, because you are not controlling the prices, and the health is becoming a commercial commodity, so that is going to increase the cost of healthcare. Participation in practicing of defensive investigations and treatments. So by defensive investigation, what we mean is physicians may, or if there are nurse practitioners in future, then they can end up doing so many investigations and unnecessary treatments for the patient. So this is known as defensive medicine, and that actually is not ethically right. So this is also an ethical situation, and the nurse can be participating in that kind of defensive medicine, since she is part of the healthcare team. So this raises the healthcare cost extensively, and this actually is not going to benefit the patient also, because the investigations which have been done are not necessary, or they are not appropriate for that kind of ailment. So a simple example is like you go for just a pain in the on your knees, and then you end up doing as X-ray, you end up doing CT scan, and you end up doing MRI, but it was just as a mild pain. So that is defensive medicine. The doctor wants to be on the right, on the saying that I have done everything, I have not missed out on anything. So because of the fear of litigations, actually that is happening. Fear of violations of the patient's or client's individuality and confidentiality, etc. So we fear that we may violate their confidentiality, and in fear of doing that, sometimes we may commit an ethical this thing, and we can commit some ethically wrong practice. So again, if the patient is in danger, then we'll have to share some of the patient's data, or to the right person. So that is actually a cause for ethical concern, if we are fearing too much about the confidentiality of the patient. Alright, so those were the list of issues which were given by TNAI. Now let's look at the role of nurse leaders in relation to ethics. So the nurse leader can identify common ethical problems occurring with regular frequency on the unit. So it is important that we have a watchful eye and ears, and we practice good judgment in picking out the ethical problems that occur on day-to-day basis in the unit. And then let's see what is there. And we have to encourage staff to seek out and utilize appropriate ethical resources within the facility, including the organization's ethics committee or the nurse leader herself. So once these problems are identified, then they can have a common ethical decision making model, which will at least resolve or attempt to resolve some of these problems. And it is important that nurse leaders also encourage the staff to speak out and seek resources within the organization to solve the ethical problems. The nurse leader should support a positive ethical environment by creating ethical policies, practices, or guidelines. So, if there are no guidelines and you are working in an ICU, then you should take a step towards making a policy or a guideline which should be used by the nursing personnel, by the physicians, so that you can solve your ethical problems. The nurse leader can provide further training, education to all staff members about ethics and ethical issues that may arise on the unit. So it is a good idea that the nurses in the unit knows about what is the role of ethics and the ethical situations that they face. So it is one thing to be, absolutely ignorant about what is going on in the unit, and sometimes we may be so overworked and so overburdened that we don't know the ethical, unethical things which are going on around us. So that is in the end going to lead to lots of burnout, because ultimately ethics is related to your morals. So if you are doing something morally wrong for a long time, then it is bound to affect your mental health and the way you perceive yourself and others. So it is important that the nurse leaders think about this and educate staff on the ethical issues that they face in the workplace, so that there is a better work environment in the hospital. The nurse can also promote open discussions among the entire healthcare team about specific ethical issues as they relate to patient care. So this can be discussed during the nurses handover or the nursing classes which are there in the wards, so that they will be able to voice out their concern regarding these common ethical issues which are coming up in their ward. So to summarize this class, we have talked about ethics and what are its uses and purposes, and the ethical principles which are applicable to health, and the code of ethics and professional conduct given by the INC. We also saw about the ethical issues which the TNAI has given, and how the nurse leaders can help in resolving the ethical problems and spreading awareness about ethics in the healthcare system. So in conclusion, know yourself and your values, because that is your ethics. Protect your patient by intervening if you identify an ethical coercion. Know your responsibilities with regard to informed consent. These are some of the references. So I have another class which I'll be continuing in this window only. Till then, I'm just closing this PowerPoint and I'm going to open the chat window. Yeah, so if you have any queries regarding this class, you can message me now. You can use the chat box to message me. I'll be starting the next class in another 5 minutes. Till then, you can use the chat box to give your opinions or views also, so that the other students can see and they can respond accordingly. So Matilda is asking, is there any written ethical guidelines for clinical nurses in hospitals? So as of now, AIMS doesn't have any clinical guideline which I know of. We have to follow the INC guidelines only, which we have already discussed in the presentation. I hope that answers your question. But that should not stop you from making one. I'm sure it will be a good idea to, meet the nursing administration and make guidelines for AIMS also, because we have a very good number of nurses working here. Last class we were discussing, we are around 5,000. So it's good to have ethical guidelines for nurses. So I'm just going to ask Matilda again whether I'm audible during the presentation, or do I need to raise my voice? Just one person, I'm asking Matilda only, so that I don't get a deluge of so many messages on the system. Okay, so she's writing that it is audible, so I will go with the that level of flow only, the level of sound or whatever. So if there are no other questions, please note that I have already sent you handout of this PowerPoint presentation 3-4 days back, so I will not be sending you any other handout, I suppose. And I have also sent you one article on ethics in nursing, so you can go through that article. I wrote that article last year for one journal. Unfortunately, I don't know whether it's published or not. I have not found out yet, but it's for your personal use only, so you can just go through it. The second class which I have for today, it's on legal issues. So let's start with the class. So the topic is on legal issues in nursing, nurses' rights and patients' rights. Law can be defined as the sum total of rules and regulations by which a society is governed. As such, law is created by people and exists to regulate all persons. So this is given by Guido 2006. So as you see in the definition, the society is governed by a certain set of rules, and these rules actually makes it easy, or they exist to regulate all kinds of conduct and people and how we behave. So the difference between legal and ethical is that if it is legal, then it is actually the law of the land, or it is punishable by law also sometimes. So sources of laws are constitutional laws, which are the supreme law of the country and which are usually not amended. They are there in the constitution. There are legislation or statutory laws which are enacted by any legislative body. So you have the legislative body at a central level, and you have even in the state level also. So any law which is actually passed by the central government, they have to be passed again in the state in order to be applicable to the people of that state. So these are the legislative laws and are amended from time to time. Then you have the administrative law. When a state legislature passes a statute, an administrative agency is given the authority to create rules and regulations to enforce the statutory laws. So for example, the AIMS Act. So this is kind of an administrative law, because this is an authority given to the AIMS to be an autonomous institute. Or the INC, the INC Act, the Indian Nursing Council Act, is an administrative law. Then there are common laws which evolve from court decisions. So these are usually based on the day-to-day functioning, or the way people behave with each other, or maybe for marriage or for property or other things in our day-to-day life. So these laws, they evolve from court decisions. Function of law in nursing. It provides a framework for establishing which nursing actions in the care of clients are legal. So it's important that we as nurses know what is the law, because whatever actions you are doing for the patient, we have to judge, or we have to weigh, regard it in terms of the law. So we need to make sure that whatever we are doing is legal. It differentiates the nurse responsibilities from those of other health professionals. So it's important that the nurses are governed by a separate act of the law, so that the nursing profession has a distinct place even legally also. It helps establish the boundaries of independent nursing action. Nurse Practice Acts. It protects the public by legally defining and prescribing the scope of nursing practice. So it can have elements which covers regarding the credentialing, that is the licensure, the certification, and the accreditation. So there is actually the step in the INC Act itself, there is a registration where the nurse has to register after they undergo the the training. They are registered in a state nursing council, and only after gaining the license the nurse should assume practice. So that is very clear. When it comes to standard of care, the law is not so strong in case of nursing in our country. We still don't have a separate Nurse Practice Act, and the standards of care are not well defined. We have just discussed about the professional code of conduct, and it says that the nurse should provide care according to the standards, but the standards as defined legally is not very clear. So as of now we just have to follow whatever is there in our syllabus. So if the syllabus has taught us about that aspect of care as per the INC syllabus, then will have to follow that and make sure that we work within the limits of the syllabus, the training which we have got. So this is in regard to standard of care. There are some legal terms which I'm sure you must have heard before also. So there are torts, and this is just a kind of a joke in the picture which says went in to buy some tarts, came out with torts. Okay, so tort is a civil wrong made against a person or property. So it can be any of the following: the denial of a person's legal right, or the failure to comply with a public duty, the failure to perform a private duty that results in harm to another. Okay, so it's a very it's a very a civil wrong. That means it's something which is not very serious, but then it happens quite often actually, that sometimes we deny some people's legal right. Of course we do that, or we may fail to comply with public duty. Like suppose there is this thing, and just a simple example, you have a waste bin which is of blue color and a green color, and you're not putting the right kind of waste in the bins. So that is actually your failure to comply with a public duty. Or you are taking your dog for a walk, and you are not supposed to let the dog pass stool on the pavement, but you did it. So that is a tort you have made. So I hope you have got the idea of what is tort, and it can be unintentional or it can be intentional. So let's see. Intentional tort is any intentional act that are reasonably foreseeable to cause harm to an individual and that do so. Okay, so it can be assault or battery, invasion of privacy, false imprisonment, intentional infliction of emotional distress, fraud, etc. We will see what these terms mean. So assault is an attempt or threat to touch another person unjustifiably. The victim fears and believes that harm will result as a result of the threat. Okay, so that's an assault. So you're just telling somebody, I will slap you. Okay, so you have just committed an assault. What is battery? It is an intentional touching of another's body without the other's consent. Example, giving injection without the patient's consent. So I hope you understood the difference between assault and battery. So let me just repeat again. Assault is a threat, whereas in battery you are actually intentionally touching another people's body without consent. Then there is fraud. Fraud it results from a deliberate deception intended to produce unlawful gains. Okay, so usually this word fraud is usually used in financial circles a lot, that you have committed a fraud. Okay, so it can be any deception which is deliberate and you are gaining out of it. So these are the common types of fraud: billing for services not provided, billing for more expensive services than were actually performed, commonly known as upcoding, performing medically unnecessary services solely for the purpose of reimbursement, billing non-covered services, example, cosmetic as other covered services, prescription fraud, providing false information during enrollment, accepting bribes or kickbacks from patient referrals, medical identity theft. Then there is false imprisonment. It occurs when a client is not allowed to leave a healthcare facility when there is no legal justification to detain the client, or when restraining devices are used without an appropriate clinical need. Alright, so I think the definition is very clear, that the health authority or the hospital is not allowing the patient to leave, okay, when there is no legal justification, or in case where you use devices, restraints without appropriate clinical need. So this can levy you a case of false imprisonment in the eyes of the law. Invasion of privacy, it includes violating confidentiality, intruding on private client or family matters, and sharing client information with unauthorized persons. So these are all those came under the intentional torts. So what is unintentional torts? These are a malpractice and negligence. So let's see, what is negligence? It is conduct that falls below the standard of care that a reasonable person ordinarily would use in similar circumstances, or it is described as lack of proper care and attention. Alright, so just to give you a simple example of negligence. So when usually I give example from my own clinical area. So again I'm giving example in the postpartum ward. So in the first 2 days of postpartum period, it is expected that the women will have flow of lochia. So when they come back from the OT, they are usually not wearing any undergarments. So it's likely that the patient's clothes and the bed sheet will be soiled by lochia. Now I always tell my students that at least for the first 2 days of postpartum period, you should use a Macintosh for that patient when you are doing bed making in the morning. So now if the students are usually the ones who do the bed making, so if they are not doing it, they are actually you know, they have actually done a negligence in the law, because they are providing care which is below the standard of care. So it's reasonable that we use a Macintosh for that woman, since we know that the patient is going to face discomfort because of not using soap. So that is just an example of negligence which we do on a day-to-day basis. Malpractice is professional negligence. So it's a failure to meet the standards of acceptable care which results in harm to another person. So these are the two unintentional torts which we have seen. So these are the types of nursing malpractice you can see: medication errors, failure to follow physician's order, delaying patient care, and a failure to monitor a patient, incorrectly performing a procedure or trying to perform a procedure without training, documentation error, failure to get informed patient consent. So this list is not exhaustive. There can be others also, but these are just giving you example of nursing malpractice which can happen. So coming to status of patients' rights in India, as you already have worked in the clinical area, there are lots of gaps between what is being practiced and the guidelines which are given. And mainly this article spoke about the patient-physician interaction. So from that point of view, most of the negation or the denial of patient rights is attributed to the existing social and legal context of the patient-physician interaction in India, or it can even be nurse-patient, because this class is for nursing. So what we can see is the healthcare personnel, that the physician is looked up by the patient, so they have a greater social they have a greater social dominance in India, and that can lead to misuse of or that can lead to denial of patient rights in the way they interact in the system. So there is physicians' disproportionate power over the patient and classic paternalism, which means that the physician takes up the role of the authority. So then they usually end up taking decisions for the patient, and the behavior itself becomes like that. So that is known as the classic paternalism. So all this leads to denial of patient rights. Again, there is a role of gender which has been defined as a decisive factor in physicians' dominance in the relations and communications with patients. So if you have a male physician and a female patient who is coming for care under that male physician, so there is again more of this inner female subjugation involved, so that can play a role in the way the patient's rights is exerted. Again, there is the role of the mixed system of public and private health system, which creates an atmosphere of mistrust and which hampers standardization of the quality of care and affects patients' rights as a whole. So many patients, they don't know actually whom to trust. So health is supposed to be a place, or the hospitals are supposed to be a place where the patient blindly trust or trust the nurses and the physicians. But because there are so many exploitations which happen in the private sector also, so the patients don't know actually whom to trust, and this can affect the patient's rights as a whole. At present, patients' rights in clinical research are being closely looked at. So as we know that almost all research which is done, it goes through the institutional ethics committee and looked into the participants' rights or the patient's rights very minutely. And there are scientific committees, monitoring boards, which monitors patients' rights, especially when it comes to drug trials and all. But when it comes to practice, despite the fact that there are few patient advocacy groups, their role is limited to provide support to patients and make their lives easier. Most of these groups do not involve themselves in patient advocacy to the extent required. So, in addition to these existing support groups, one requires active advocacy groups. These may be made up of present and former patients, physicians, and paramedical individuals. So, as of now, we don't have that kind of active advocacy groups for patients, but it is important, and this is very much prevalent now in the West, where they have this patient advocacy groups in the hospitals, and this will have patient representatives, and they will have physicians, they will have nurses. So the information is shared and everyone takes decision together, and that makes it easy for them to do what is right for the patient. So it will take a long way for India to reach that kind of level for patient rights or advocacy, but then it is never too late to start, and one should think about having that kind of group. So if you look into the website on Institute of Health Improvement, there are lots of online courses on patients' rights, and you can see that the patients who are harmed due to medical errors, some of these relatives, they come back and then they join these patient advocacy groups, and they are encouraged by the healthcare team also, the doctors and nurses. They encourage them to speak out about what happened to them, how they felt when this error happened, and this is important so that they prevent the next error. So even they speak up with their stories, they are very powerful, and they have the implication to touch or to move other people, so that they take up more of patient advocacy roles, and harm is prevented for the patient, and patient is safe in the healthcare system. So the role of the patient advocacy groups will be to advise patients on the best therapy for them, how to choose between conflicting options, and to ensure that they get the rights granted to them as citizens and human beings. So these are some of the progress made. An ombudsman is being established in the form of the National Health Regulatory and Development Authority that will monitor and enforce standards of healthcare delivery. The authority being established at the instance of the Planning Commission will regulate and monitor, audit both public and private sectors, and provide redress of complaints. The Human Rights Commission too has also taken up the issue and is considering draft legislation seeking to protect the rights of patients and ensure that standardized treatment is available to everyone. The Medical Council of India published in, so that was about the status of patient rights in India. So coming to patients' rights, let's look at some of the patients' rights which are there in current guidelines. So the Medical Council of India published in 2002 a Code of Ethics Regulation, we will call it as COER, which deals with the duties and responsibilities of physicians in addition to certain rights of patients. The Consumer Guidance Society of India have the 8 specific rights of patients. However, there is no automatic respect for patients' rights in India, and if they are violated, the only recourse for patients is to approach the consumer, because violation of patients' right is not a cognizable offense in India as it is in the US and some other countries, which means that since it is not a cognizable offense, you cannot arrest the violator. So in case it becomes a cognizable offense, if you don't follow the code of regulations, or you violate the patient's rights, then you can be arrested without a warrant. So these are the rights of the patient as given by the Consumer Guidance Society of India. You have a right to be told all the facts about your illness, to have your medical records explained to you, and to be made aware of risk and side effects, if any, of the treatment prescribed for you. Do not hesitate to question your doctor about any of these aspects. When you are being given a physical examination, you have a right to be handled with consideration and due regard for your modesty. You have a right to know your doctor's qualifications. If you cannot evaluate them yourself, do not hesitate to ask someone who can. You have a right to complete confidentiality regarding your illness. If you are doubtful about the treatment prescribed, and especially an operation suggested, you have a right to get a second opinion from any specialist. You have a right to be told in advance what an operation is for and the possible risks involved. If this is not possible because of your being unconscious or for some other reasons, your nearest relatives must be told before they consent to the operation. The COER states, before performing an operation to the physician, the physician should obtain in written the consent form from the husband or wife, parent or guardian, in the case of minor, or the patient himself as the case may be. In an operation which may result in sterility, the consent of both husband and wife is needed. If you are being discharged or moved to another hospital, you have a right to be informed in advance and to make your own choice of hospital or nursing home in consultation with the doctor. You have a right to get your case papers upon request. So those were the patient's rights given by the consumer regulations. Now some do's and don'ts for safe practice. So as a nurse, you should document all unusual incidences, to report all unusual incidences, to follow policies and procedures as established by your employing agency, to perform procedures that you have been taught and that are within the standard scope of your practice. So I've discussed earlier, whatever has been taught to you in your training, you can practice, but out of that beyond that scope, you cannot. Do not work as a nurse in state in which you are not licensed. Do protect the patient from injury. do not advise that is contrary to the doctor's order or nursing care plan. But then again, you will have to see that whatever is in the doctor's order is right. If it is wrong, then again it is your duty to discuss with the doctor. So coming to roles and functions of nurse in legal issues. So the nurse should serve as a role model by providing nursing care that meets or exceeds accepted standards of care. The nurse should report substandard nursing care to appropriate authorities. The nurse should foster nurse-patient relationships that are respectful, caring, and honest, and thus reducing the possibility of future lawsuits. So it is important that nurse maintains the interpersonal relationship, and this is supported by other research which has been done on legal issues. So it has been found that patients usually don't sue the physician or the nurse practitioner who has a good relationship with them, even if they commit errors. They tend to sue those healthcare providers who are rude in behavior. So if you are maintaining a good relationship with your clients, you are giving them timely information, you are being honest with them, then it's very unlikely that they will sue, they will take a legal action against you. And the reason was, if you are nice, then the patient will think twice before suing you in the court. And the only thing the other the people who sue actually put a case on the physicians and nurses. Their response was that they felt neglected, and then they don't want the same thing to happen to another person, and that's why they are doing it. A nurse can also join and actively support professional organizations to strengthen the lobbying efforts of nurses in healthcare legislation. Practices nursing within the area of individual competence, prioritizes patient rights and welfare first in decision making, delegates to subordinates wisely, looking at the manager's scope of practice and that of those they supervise. They increases staff awareness of intentional torts and assist them in developing strategies to reduce their liability in these areas. Provides educational and training opportunities for staff on legal issues affecting nursing practice. Role of institutions and organizations. The Medical Council of India, or the IMA, and for that matter the INC TNAI, could take a lead in redefining the rights of patients. Hospitals should have committees on the lines of the IRB that will ensure that patients' rights are protected in hospitals. Hospitals should have their own systems rather than depending on the government. So it is important that this starts from bottom up. So we should not always wait for the national bodies to make guidelines for us. We can have our own guidelines based on international standards which are available, and then we can follow them for maintaining the rights of our patients. So in summary, we have discussed about what is law and what are the different types of legal implications in terms of torts, intentional and unintentional torts, which nurses can face, and what is the status of patients' rights in India, and what we also discussed patients' rights which are there in India, and what is the role of nurse manager and our institution in terms of legal awareness. So in conclusion, every nurse should act as per the legal guidelines for nursing practice while caring for patients, since negligence may cause a great distress to nurse, the patient and others, as well as to reputation of the institution. So with that, I'm concluding this class, and I will be opening the chat window. If you have any suggestions, queries, you can write here. Mangilal has written, what is the difference between standard of care and standard operating procedure? So standard operating procedure usually affects the standard of care, so it is, but it is specific in nature actually. If you are saying standard of care, standard operating procedure, it is usually related to a certain activity, like SOP for infection control, or SOP for intubation, or for resuscitation, or whatever. But when you say standard of care, then it is more of a broad term. Okay, so that is I think that is the main difference. It's in terms of usage कि आप कैसे use करते हो इस term को. So that's the only difference. I hope my answer is clear. So here Sakshi has written, what is the difference between malpractice and negligence. So negligence, actually you are falling short of your duty. It is a general term, whereas malpractice usually relates to medical practice. So if it's happening in the hospital, that is malpractice. So this is the difference between these two. If there are any other questions, you can ask. We have lots of time actually. I have booked the studio till 4. It's going to be 3:30 now, but we can spend another 5-10 minutes in discussion. Shalendra is asking, failure of taking informed consent is a malpractice by a nurse or a doctor. So legally, taking an informed consent is the duty of the doctor, because if the procedure is going to be done by a doctor, so usually in our case, the informed consent is usually taken for a procedure which a doctor is going to do. So in the eye of the law, the doctor is liable for that. So actually the malpractice will fall on the doctor, but there should be enough evidence to say that the nurse has refused or has laid down, saying that there has verbally or whatever in written said that she or he will not take consent from the patient. Otherwise again it will be, the nurse is again legally answerable because she is doing something which she should not do. So that is again fraud. The nurse is committing a fraud, and the doctor is committing a malpractice. So both of them are in legal problem. Can INC or TNAI legally put their view if any patient sue case against nurse? Matilda is asking, can INC or TNAI legally put their views if any patient sue case against nurse, or is it dealt by concerned institute body? In this case, I think since the nurse as a profession is governed by the INC, so they will definitely look into the INC code of conduct and professional conduct. So if the nurse has not done her duty according to the professional standard which is given in the code of conduct, then the nurse is legally in the wrong. But of course, if there is a standard of practice by the institute body, like AIMS has a standard of practice for nursing, and the nurse who is working at AIMS have not done it, then she is legally answerable. He or she is legally answerable for that. So I hope I have answered your question, Matilda. So we have two responsibilities. As a nurse, we have to follow, which is mandated by the INC. And if you are a member of a TNAI, of course, you are again, you should follow their guidelines. And then you are working in AIMS, then you are also liable to follow, you are mandated to follow the rules and regulations which the institute has for its employees. Sachin is asking any updates on Indian Nursing Practice Act. As of now, I don't have any idea how much it has progressed. It is still not in the public domain, as I do know that there is some discussion going on for that, but it's still not out there in the public domain. So usually if they are going to put up in the parliament for as a bill, then they will put it out in the public domain for some time so that the public or the concerned people can put their inputs into it. So that is not yet. If you guys know of any such thing, you can always share with me also. So Matilda is asking, means can nurse directly approach INC? Yes, of course, you can directly mail, write to the INC, take appointment to discuss any issues which you have with them. Actually, just yesterday I wrote a mail to the secretary of INC. I was before I was preparing for this class, and I wanted to know whether there are any updates on the professional code of conduct, since it is an old one. But I realized that in the INC website they have not given the code of conduct, code of ethics as well as the code of professional conduct. It is available as a book, and so you have to order that book on payment, okay, after paying. So I just wrote to the secretary that this document or this code of ethics and professional code of conducts are very essential document for nursing practice, and every nurse should know it. So it is not right that they have to pay, and that also by print, okay, and it should be accessible to everyone in the website. So that's what I have written. So like that, you can also put your thoughts, your opinions, write to them, so that they also know that there are nurses who wants to know what is the code of ethics, and they are worried about their practice. Mangilal is writing, is bargaining through professional bodies ethical, unethical? It is not a matter of I think ethics, I should say, but it is legal to bargain through professional bodies. So the Union Act, or the act which governs the union, the industries, they allow for collective bargaining through professional bodies, and they have to follow the rules and regulations which are given by the Industrial Disputes Act, and they can do collective bargaining. The issues which they take up may be ethical or unethical depending on the type of issues they have, but that is for the professional bodies to decide what issues they should do bargaining. So yeah, I hope that answers your question, Mangilal. Chandni is writing, if NG tube insertion is prescribed to a patient and he denies to get it done, what a nurse should do. I think it's important that the patient is in the right frame of mind to refuse. It's very important that the mental status of the patient is, it's right, and they are deciding with their full consciousness. So if actually the patient is, in their right frame of mind, and it's not delusional or under the effect of drugs, or not compromised, their mental status is not compromised, and they really do not want to take NG tube feeding, then the nurse should document, and then it's a responsibility of the nurse to tell why he or she wants the patient to get an NG tube, and what will be the benefits, and if the patient doesn't take the treatment, what will be the harm. And then that is, the patient has, as we say, so in the four fundamental ethical principles, the first one is the autonomy. So actually it is the right of the patient to refuse any treatment that he or she doesn't want. So you are respecting the right of the individual. I hope that answers your question. And so it's whenever there is any such instances where the patient refuse, it is the duty of the nurse to document whatever had happened, and what actually the nurse has verbalized to the patient regarding that procedure. It should not be just a one line, okay, patient refused to take NG tube. No, the nurse should record what the patient was approached for, insertion, and was told about the benefits, the need, and with after taking all that into consideration, the patient has refused to get the NG tube inserted. So that's it. So I will end this presentation in another 3 minutes. That will be 15:40 by my watch. So you have another 3 minutes. If you have any other question for discussion, you can type in your queries, or you have anything to add also, you can type in. So if there are no other questions, I will be ending this class here. I hope you are doing your assignment which I have given you. You can mail it to me. If you are writing it, if it's handwritten, you can scan it or take photo and mail it. I hope you will have an interesting time looking through the INC website and the sample 2 websites I've given you in order to compare the nursing council, how they are actually putting up information and how user friendly it is and all those kind of things. So with this we are going to finish this unit also. There is one seminar pending which Janni will be taking on Saturday 11 to 12. Until then, you stay safe, eat healthy, and let's hope we'll see each other very soon in person. Thank you everyone.